All right, so I'm going to welcome everybody. Good morning, good afternoon, good evening, wherever you are in the world. At last count, we had over 350 people registered. So switch in, make room for everybody. So, all right, let me do a little housekeeping here and then I'll get started. Want to remind everybody, for those of you that don't know, Giving Tuesday is coming up November 28th. If you don't know what Giving Tuesday is, that's kind of like to combat the consumerism of Black Friday and Cyber Monday. Then we have Giving Tuesday on the 28th, where you get a chance to give back. And this year, our campaign is Give a High Five for Feline Health. So we're asking that you make a donation that starts with $5, $50, $500. And if you're really, really into it, a complete grant only costs $50,000. So mark that down. All right, moving on. I'm going to turn this over now to Tanya from Baseballs, who we are so appreciative of their sponsorship. And she's going to introduce you to Dr. Saffire. Tanya.
Thank you for Virginia. I would like to introduce our speaker today, Dr. Saffire. Dr. Ashlie Saffire is a graduate of The Ohio State University and is board certified in feline practice by the American Board of Veterinary Practitioners. She is a published author and tutor for the University of Sydney's Feline Medicine Distance Education course, and she is both fear-free and cat-friendly certified. Dr. Saffire is the president-elect for the American Association of Feline Practitioners and practices feline medicine and surgery at the Cat Specialty Center at Faithful Friends Veterinary Clinic in Dublin, Ohio. Ashlie, thank you.
Hi, everybody. Welcome to our afternoon webinar. I'm actually really excited to talk about this subject matter because I am a practicing veterinarian. I am actually in a general practice that sees all sorts of types of cats. And this subject we're talking about tonight is something that is very near and dear to my heart. I see seniors all the time, and I hope that those of you out there also in similar practices are seeing senior cats, and I hope that what we go over today, you can take something with you and improve your treatment of our senior kitties. So our learning objectives this afternoon are to go over the senior life stage, discuss the recommended diagnostics, the preventative care plans, things you should be doing when these guys come in your door. We're going to discuss the prevalence of CKD in our cats population, the benefits of early detection, and talk about a new and coming diagnostic technique that is looking at the oral microbiome and how its role can help us to potentially identify patients with CKD. And then we're also going to go over systemic hypertension and talk about why it's so important that we're screening our seniors for this disease, and how we monitor and practice, some tips, tricks, and how to select appropriate treatment. So first of all, feline life stages. Coming from the AAFP and the AHA Feline Life Stage Guidelines, which were published in 2021. This is a really great document that if you haven't looked at and you are a practitioner who sees and treats feline patients, it's a great resource to take a look at. It goes through the different life stages and helps you to figure out what you should be really focusing on as these cats age. We're going to talk today about the senior cats, a little bit about mature adults, which is starting at age 7, but really those cats who are around age 10 and older. One of the nice features of these guidelines is it breaks down the different ages and which diagnostic tests we should be doing. So annual diagnostics like blood work, talks about blood pressure when we should be retroviral testing, and then how often we should be doing that. And so we're, again, going to be looking at blood pressure. And you can see based on this diagram that the single plus mark is a consideration. These are the cats you want to consider something. When we start seeing 2 pluses and 3 pluses, that's when we're strongly recommending. So blood pressure for cats is currently recommended to be monitored at age 7. We should also be checking these cats for kidney disease at age 7, and that includes a urinalysis as well. And so we really want to try to establish those healthy baselines in these cats who are starting to age, and that way when we do start to see changes, we are seeing them early and we're able to do something about it. So what do we know about the prevalence of chronic kidney disease? And here are some stats for you. So CKD is diagnosed in 30 to 40% of cats over age 10. In one study done in the UK back in 2015, they found that this was the most common cause of non-traumatic death in cats over the age of 5. So that's a pretty significant disease process. We also see a prevalence rate of 80 to 86% of all cats that are over 15 years of age. I'm just making sure I don't have, sorry, my question and answers was up. And I see some questions already coming in, so I'm excited. We'll go over those at the end here. All right, so what are the causes of feline CKD that we know about? Well, in a 2016 review that was done by Veterinary Pathology, Brown et al., and these references are all listed for you on the slides, they found that there was numerous factors that we know can lead to CKD or be contributors of CKD: polycystic kidney disease, amyloidosis, renal dysplasia. These are pretty uncommon. They tend to be more breed specific, usually a genetic basis to them. We also see things like immune complex glomerulonephritis, an unbalanced diet, or acute kidney injury. Again, these are more rare causes. What the vast majority that we tend to see in our senior population is idiopathic. So what does that mean? Well, when we have an idiopathic disease, and it's very common, there's a lot of factors that are probably involved with development. And it can be anything from the genome of the patient, their molecular process of aging, right? As they age, their kidney cells get older, they get degenerative diseases, their environment, right? What they're exposed to at home, what other disease processes they might be dealing with, what medications they might be on, and then their microbiome. So how can we use these different factors to help us identify at-risk patients for idiopathic CKD, such as the microbiome? Well, we'll talk about that. So what we know about chronic kidney disease and what we have for diagnostics currently are traditional renal biomarkers, right? We run lab work. We know there's tests like SDMA, renal tech through Antech that can be really helpful in bridging that gap between lag of blood work changes with kidney disease. However, we're still not catching these cats soon enough. We know that stage 1, they can have pretty normal blood work for a significant period of time before we start seeing evidence of it on our annual diagnostics. So with this delay, what can we do for these guys? So something to think about and something that's exciting that is coming in the future is looking at the genetics and the oral microbiome of our patients and using this to potentially identify risk factors for development of chronic kidney disease. So this is pretty exciting. So no longer do we just have routine lab work, but we can also use things like oral microbiome screening. Let's talk about that a little bit more detail to give you a little more information. So a review of terminology, the microbiota. So this is a community of microorganisms that's characterized by taxonomy and abundance living in a given environment. So this would include things like bacteria, viruses, archaea, microscopic eukaryotes, and things like fungi. And then with that, we can look at the microbiome, which then refers to the genetic material of the microbiota. And so in this case, we're observing and we're quantifying that genetic material of the organisms rather than the actual organisms themselves. So why do we study the microbiome? Well, genetic material is really only one aspect of a patient's health. And so the total health of our patient is determined by that interplay between the genome, their environment, and their vast microbiome. Microbiome, we know, is everywhere, right? We have trillions of bacteria in our feline patients. They're actively growing, they're consuming nutrients, they're producing molecules, they're interacting with fellow microbes. We find them in the oral cavity, on the skin, the gastrointestinal tract. And so it's really important that when we're studying the microbiome, we're not just identifying certain species of bacteria, but we're understanding all the species that exist and how they interact with each other. So what can we do with that? Well, by defining a microbiome signature or pattern in a patient while they're diseased or while they're sick, we can potentially identify a possible diagnostic, an area for diagnostics or a diagnostic test, maybe a predictive metric for a disease. We can identify an area of future research, and we can identify therapeutic targets. So right now we're not there just yet, and it's important to know that the information we have out there is more correlation at this time and not a direct cause and effect or causation, but it's coming and it's really exciting. This is just a slide of what we know in humans right now. There's a lot of research on the human side of things, and it's no surprise that oral microbiome influences oral health and other disease processes. So we have very specific sequencing in humans on the cause of different cavities, different periodontal diseases. We see different microbial signatures with certain cancers, including squamous cell carcinoma and distal alimentary cancers like esophageal carcinomas. And then we also can see a correlation with autoimmune disease, systemic cancers, neurologic diseases. So it's really exciting stuff. When it comes to kidney disease in humans, there has been a growing body of evidence that's actually been able to connect the oral microbiome and GI microbiome to kidney health and disease. We know that in a healthy microbiome, we specifically can see short chain fatty acids that are produced by the beneficial microbes. They protect against inflammation in the kidney. They regulate blood pressure. They can help promote or protect the entire body by improving the health of the intestines. And then we also know that in dysbiosis, we have bacterial products such as TMAO, indoles, ammonia, and these all contribute to uremia and the worsening of the kidney inflammation, which eventually leads to fibrosis. So what we can conclude from this right now and from this research we see in humans is that we can't say that a particular bacteria is causing disease, but we can instead identify patterns, something like a microbial signature that coexists with the disease state. And so trying to find that connection between a microbial signature in our patients and potentially using that to help us detect a risk factor for something like kidney disease is really exciting and coming this way. So that is where I leave you with that. Stay tuned. There's some exciting research coming that hopefully we'll see more published papers soon. So we're going to shift gears a little bit and focus on systemic hypertension. So this is a common condition that is often seen in older cats, but it's thought to currently be pretty significantly underdiagnosed. If we were in a live conference hall right now, I would have everybody raise their hand to find out who is routinely measuring blood pressure in cats over 7. I would probably see that there's not a lot of people who do that yet. And I'll show you why. We have some evidence of that with some surveys that have been done here in the States. But it's really important that we are assessing these patients starting at age 7. We know there's been plenty of studies that show that as our cats age, we are seeing an increased risk of hypertension. So hopefully by the end of this part of the talk today, I will convince you why you need to start taking blood pressures in your patients. So the truth hurts. So here's the study I was referring to. In 2022, this was mainly North American practices, but a study or survey was done of non-invasive indirect blood pressure in practices done on cats by veterinarians. And they actually found that most of the time when a blood pressure was taken, it was only following target organ damage. So that's 86% of the time is target organ damage. So that's things like brain injury, kidney disease, heart disease, right? So mostly there was a trigger or reason that they were looking for blood pressure. Other cases, there was evidence of a disease process that prompted the veterinarian to get a blood pressure. So chronic kidney disease, hyperthyroidism, something that predisposes them to systemic hypertension. Only 27% of the surveyed veterinarians recommended blood pressure in a healthy older cat over 7. So it's really important to keep that in mind. And not to make us feel bad in North America, but a similar study was done also in the UK, and I'll share that one in a second. But when they asked these veterinarians, what were barriers to blood pressure? Why are we not getting that blood pressure taken? One of the most common reasons was cats were really stressed, high fear, anxiety, and stress. It was really hard to interpret results. How do we know if this cat is truly hypertensive if he's so stressed out? It's difficult to perform in cats. I can definitely attest to that. In some cases, it was because the technical staff didn't feel comfortable performing this procedure in cats. They didn't feel comfortable restraining. They didn't feel comfortable obtaining measurements. It was too time consuming for 23% of respondents. In some cases, the owners just declined, potentially because of an additional cost, potentially because it was too stressful to see their cats having this done. And then lastly, because they just felt that it was unnecessary and didn't really give them much value. So what about in the UK? Well, this study was done actually a couple years earlier in 2018, and they found pretty similar findings that, again, blood pressure was routinely recommended for cats only with target organ damage, specifically ocular, chronic kidney disease, evidence of proteinuria, and hyperthyroidism. So very similar to what's happening here in North America. And again, the barriers that they had expressed for why they weren't doing it was cuff frustration, which is when it's difficult to find the right size, difficult to get the cuff on the cat, trying to hear the pulse of the Doppler if they were using a Doppler device. Situational hypertension, again, that's that high fear, anxiety, and stress that we know can contribute to our feline patients and false elevated readings. Lack of time to perform, their machine just didn't work. Persuading the owner to get the cat in, and then cost. But I will say one of the reasons that I didn't see in either of these studies, or a reason, or a not a lack of the ability to do it, or a barrier to this, was lack of equipment. So everybody had equipment. There was actually only 3% of practices surveyed that didn't have equipment in their hospital. So that means everybody else had it. We're just not doing it. And there's my slide. Sorry, I'm ahead of myself. All right, so what do we have currently for feline blood pressure? And I'm talking indirect monitoring. So this is what we have readily available to us in general practice. Doppler is the number one that we see. It has a pretty good correlation and accuracy when we compare that with direct blood pressure monitoring when used with headphones. And I think that's a key here. And actually, Dr. Jessica Quimby is in the process of looking at and publishing some information and data for us that whether or not you wear headphones with the Doppler can actually affect situational hypertension. So something to keep in mind. There is a port on these Dopplers that you can place headphones and quiet down the Doppler signal and not startle your patient while you're getting your readings. Traditional oscillometric is a little bit less accurate than Doppler in conscious cats. It does often underestimate the blood pressure when it's at higher values. And then we have this newer high definition oscillometric. This one is shown to produce pretty accurate results when compared with direct as well. In my practice, I routinely use the Doppler blood pressure monitors. So when we're doing blood pressure, and this is going to be a little beyond the scope to go into the nitty gritty of how I take blood pressure readings, but just some key points to keep in mind while you're taking blood pressure in your patients. Make sure you pick a limb that you position to the the level of the cat's heart. So ideally, they're either sternal recumbency or they're lateral recumbency. If they are lateral, use the non-dependent leg. We don't want to have any false pressure on them that could be potentially elevating their blood pressure measurements. If you need to use the tail, ideally you would reserve that for cases of using the HDO device, potentially a cat who might be really painful when you manipulate its feet. So something like osteoarthritis of the limbs or paws, or just really sensitive about paws. We've all met those cats that just don't like their toes being touched. Make sure you always take at least 6 readings. The first reading should always be thrown out. That's your first one that finds where you are, and then average what you have remaining. Of course, if your blood pressure is coming down, you want to try to get it where it's more stable and you're getting several in the same group. If all of a sudden it shoots up, something may have startled the cat, probably not a good reading. So just trying to be aware of your readings and the trends that you're seeing while you're taking them. And then again, of averaging what you have. Always make sure that you record the patient's position, the cuff size, and the limb. It should be in every medical record every time you take this. And that way, every year when they come back, you're getting an accurate trend in that record, and we're doing it the same way. And you don't have to worry about positioning or other factors that could be causing a change in this cat's blood pressure. This is a really great resource for people who are still uncomfortable with taking blood pressures. It's an educational toolkit that's been published by the AAFP, available free to all members. It is a very thorough, very thorough multiple page document that goes into very much detail, a lot of what I'm talking about today, but also how to take it properly, when to take it. So it can be really helpful, what to do when you get an elevated blood pressure. So I definitely advise or encourage you guys to check this out. But essentially, this is my treatment plan in my hospital. I perform blood pressures every year starting at age 7. This is when you want to start talking to owners about it. I also started at age 7 because I want to get a healthy baseline. And maybe for some of those cats who are a little bit nervous and maybe they run a little high in the hospital, I'm fine with a blood pressure of 150 if every year at age 7, age 8, age 9, he's always 150. But when he comes in then and he's 11 or 12 and now he's 170, that's going to catch my attention that there's something going on with this cat that's made this elevation or this change in blood pressure. I'm also going to perform a blood pressure twice a year at a minimum with diseases like chronic kidney disease, diabetics, hyperthyroid disease, of course, heart disease. And then every 3 to 4 months, if they are currently on treatment for hypertension, we want to make sure that we're monitoring them appropriately. And again, for more guidance on environmental techniques to reduce fear, anxiety, and stress, definitely check out the hypertension toolkit. I do want to make a note about gabapentin, chronic kidney disease and blood pressure, because this is very exciting stuff. We know gabapentin works really well for some of our anxious kitties and nervous cats, but I want you to be aware of a study that I was actually involved with that we published in 2022. And we looked at cats that had CKD and we compared them to normal cats, healthy cats without evidence of kidney disease. We gave the healthy cats 2 doses, 10 mg per kg and 20 mg per kg at different time points. And we gave the chronic kidney disease cats all 10 mg per kg across the board. And what we found that the chronic kidney disease cats had actually higher serum gabapentin concentrations than the normal cats at both the 3-hour and the 8-hour normal, with cats that the normal cats that had both the 10 and the 20 milligrams. So you can see that in this diagram. I'm not sure if you can see my pointer or not, but you can see how much higher those serum concentrations were for the gabapentin cats, the chronic kidney disease gabapentin cats. And so what we really encourage is a dose reduction in these kitties. We shouldn't be giving them those full doses because we know it's going to make them more sedated. We know that they have higher gabapentin serum levels, and we want to be really careful. And we did find a significant correlation between creatinine level and SDMA. So the higher the grade of kidney disease, the more these cats were affected, the more sedated they were from their gabapentin, and the higher their serum concentration. One thing we forgot to do during this study was check blood pressure. And so this actually is not published yet. We've submitted it for publication. So I'll share with you a little bit of the details from this study, but we did essentially repeat the study and check blood pressure. And what we found in this situation was, as we suspected, that a single dose of 10 mg per kg gabapentin actually reduced in a pretty significant drop in blood pressure when compared to placebo. And we did this for both healthy cats again and cats with CKD. In the CKD subgroup, the gabapentin resulted in a decrease of blood pressure to an average of 137 milligrams of mercury when compared to the placebo, which was 157. So that was pretty significant. In the healthy group, we saw cats that had a blood pressure of 121 when on gabapentin. Compared to placebo, they were 137. And based on some more information and data that we will share in this study, and based on the mechanism of action of gabapentin, we felt that it's very plausible that this direct cardiovascular effect is happening. It's not just simply related from reduced stress. We really feel that there is a change physiologically happening in these cats. So we do just want to remind everyone, keep in mind that when you have these cats coming in on gabapentin, that it could potentially be lowering their blood pressure. And so really try to dose reduce if you can, and especially in those chronic kidney disease cats. So stay tuned for that paper. We're hoping it gets published. It's exciting. All right, I just realized you can't see this very well. I apologize for that. So systemic hypertension diagnosis, these are our main categories. We're looking at cats who are less than 150 millimeters of mercury. These cats are normal. These are cats that are, their risk of target organ damage, very minimal. We're not going to be worried about them. Again, like that 7-year-old cat that might come in with 150, monitor him, watch him every year, watch for any changes. Once they start to be above that, 150 to 159, this is when they become borderline. We really want to be careful that we're monitoring this cat's a little bit closer. Their risk of target organ damage is still probably pretty low, but we want to keep a closer eye on them. Once they start becoming 160, over 160, 160 to 179, now we're hypertensive. Now we have a risk of target organ damage. It's becoming more moderate. Over 180, this is severe hypertension. These cats are at high risk for target organ damage. To avoid situational hypertension causing some confusing results, Whenever we have target organ damage evident, we're going to go with that diagnosis of hypertension. We don't want to mess around, right? But if we have high blood pressure, we're not sure, we think this might be situational, we don't see evidence of target organ damage. So normal retinal exam, kidney function is good, no signs of any neurologic deficits, for example, then it would be reasonable to have this cat come back in 1 to 2 weeks to have a recheck blood pressure. And that's typically what I do. And I'll usually say that when the blood pressure is over 160. That's my cutoff when I want these cats coming back in, just to make sure that that wasn't a situational problem. So we're going to go over the main causes of hypertension. I've said this several times, this word situational. So what does that mean exactly? It's a response to an acute excitement or some kind of anxiety that resolves once the stimulus removes. So this could be because of some generalized anxiety. They're coming to the animal hospital, there's a barking dog next door, they're exposed to scary smells, scary sounds, they're being restrained in a way they don't want to be, or maybe they have chronic pain and they're hypertensive because they're painful and we're manipulating them. Maybe they have periodontal disease or osteoarthritis. So how do we avoid that? Well, using a feline-friendly handling technique in a calm, quiet environment is going to help reduce that. And I'll touch base on that again here in a little bit. Other causes, idiopathic. So 10 to 20% of our cases of hypertension in cats is primary. And this means we don't know why, it happens on its own. There's no inciting cause for this hypertension. So this is a persistent pathological hypertensive issue in the absence of any identifiable underlying cause. So not super common. What's most common is secondary hypertension. So this is the result of an underlying disease condition that the cat already has. The most common, as we all know, is chronic kidney disease. So 20 to 60% of our chronic kidney disease patients are going to be hypertensive. So that's huge. It's the most common condition associated with this disease. Azotemia, we're going to find in 75% of our hypotensive patients. So that means that there's still a percentage of our cats who aren't azotemic. So those really early chronic kidney disease patients, but for the most part, they are. So a great way to start when we're doing our exams and we're checking these cats for hypertension in an exam room and we detect hypertension, we can immediately tell the owner, we absolutely need to run blood work. There's a really high chance that we may catch azotemia in this patient and catch underlying kidney disease. So that also helps us to convince that owner or caregiver why we need to run diagnostics in that patient. Prevalence and severity of hypertension does not appear, however, to be related to the severity of CKD. So again, we could have a stage 1 patient who's non-azotemic, but who could be pretty severely hypertensive. Another disease process is hyperthyroidism. And this is a big one that I don't think a lot of people realize, but we actually only see hypertension in about 10 to 20% of cats at the time of diagnosis. When it really happens is actually after the cat has been treated, he's now euthyroid, and he was normotensive at the beginning, and now he is hyperthyroid, now he is hypertensive. So we've actually checked his blood pressure after he has been diagnosed, after he's been treated, and now he becomes hyperthyroid. So these guys really should have blood pressure monitored very closely before, during, and after treatment. So make sure you keep that in mind as part of your thyroid patient protocols. Some other causes of secondary hypertension include primary hyperaldosteronism. So this is a pretty uncommon disease in general. Maybe it's unreported, still kind of unclear, but it's characterized by that hypokalemic cat that no matter what you throw at it, no matter what potassium supplement, we can't get that potassium level up. They're weak, they're PUPD, and they're hypertensive. So keep that in the back of your mind with some of these systemic hypertensive patients that are also hypokalemic. Hyperadrenal corticism, again, pretty uncommon in cats. 19% of the time, they are hypertensive though, so keep an eye on that. Where we see complications are when we have associated DKA conditions, skin fragility, target organ damage. So not super common, but something to think about. Pheochromocytoma is pretty rare in cats. Usually these guys are presenting with pretty significant target organ damage, so you're going to know right away there's something going on. And then remember, there's a couple medications that can induce hypertension. Our erythropoietin stimulating agents like darbepoetin is one of them. Ephedrine and albuterol, probably not going to be as commonly used. So Darby's the one I usually tell people to really keep an eye on when you start a patient for anemia. One of your kidney patients, make sure you're monitoring their blood pressure. What about diabetes? Historically, I think we all thought that diabetes was something we needed to be really careful. And I do still check my diabetics twice a year for blood pressure changes. However, overall, it's pretty uncommon to be secondary to diabetes. And there actually was a study that looked at about 17 cats with diabetes, and they found, it was at University of Pennsylvania, they found that 76% of the cats that had diabetes mellitus and systemic hypertension had at least one other documented concurrent illness that could contribute to systemic hypertension. So I think it's really important to monitor them. If you see all of a sudden a diabetic developing hypertension, it's really important that you start looking for potentially another cause, like hyperthyroidism. We see that a lot, or maybe a functional adrenal mass. Just keep that in mind as well. So circling back to situational hypertension, how do we treat hypertension? How do we treat this situation? And I am going to give a plug for the AAFP's cat-friendly certifications for both the individual and the practice. It's really something to think about. If you haven't looked into this certification, it really changes the environment for your cats. It requires two main things. You're modifying the physical space, and these aren't huge modifications. These are pretty small ones that can make huge differences in the reception area, the examination area, the treatment and hospitalization ward. Helps you accommodate that feline patient, and it improves how the veterinary team interacts with the patient. And not everybody is in a place in their clinic where they can get their practice certified, but there are individual certificates. And where this comes in is those technicians who are struggling to handle cats comfortably, who are one of the main reasons or one of the main barriers to systemic hypertension or blood pressure monitoring in our cats to detect this disease, is they're just uncomfortable. They don't know how to handle them. And so this is a one-time course that you can enroll anybody from assistants to technicians to veterinarians that helps you really focus and hone in your feline specific skills. It helps you build confidence working with cats. It showcases this to feline owners. They really see it in the way that you treat and handle their cats. It gives you tools to educate your clients on diseases and things they need to do at home. And it helps clinics develop talent and understanding of cats. So really overall, it's a really great way to improve veterinary care in your hospital. So I highly recommend looking into this program if you haven't before. One other supportive evidence for it, this paper just got published yesterday, actually. Again, it was something I was able to be a part of, and I'm very excited about it. But we were able to show that cat-friendly practice improves feline visits. It results in increased laboratory testing and improved diagnosis of certain feline conditions. So here you have it. This is the data that if you are a cat-friendly practice, and we made sure to compare to cat-friendly practices like myself, who is canine feline, that you can be cat-friendly and you can improve and increase the number of patients that you're seeing every year. You improve the number of diagnostics that you're doing. So you're going to catch these diseases like CKD and hypertension sooner. So really cool. If you haven't seen it yet, take a look. It's really exciting. So summarizing cat-friendly, you're improving your cat visits, you're improving your veterinary care, you're minimizing stress, you're really going to minimize those situational hypertensive situations. You're going to get more diagnostics performed in these patients. So your seniors are going to be coming in more frequently. You're going to have less workplace injuries. And that's also published data that workman's comp numbers are much less for cat-friendly practices than those that aren't. You have happier pet parents and you have happier staff. All right, so target organ damage. We've also talked about this a lot. Left undiagnosed, left untreated, hypertension can result in really life-threatening situations. We can have heart failure. We can have neurologic strokes. This was a cat that came in, a senior cat. You can see him head tilted and very vestibular, had an acute vascular event because of acute hypertension. We can see retinal issues like the cat on the lower left. And then we can see, of course, over time trauma to those kidneys. So we really want to take care of these cats before we get to this point. So what do we have in our toolkit? When do we use these items like amlodipine, benazepril, Sementra? I'm going to talk a little bit about amlodipine and tell you why we're starting to sort of shift whether or not we want this to be our first line treatment for our hypertensive cats. Everybody knows amlodipine. I'm sure everybody here who practices vet med has prescribed it at some point. It's a calcium channel blocker. It works really good for feline hypertension. It treats both primary and secondary, so we can use it for both scenarios. It is a peripheral vasodilator, so it's going to result in a decrease in systemic blood pressure, exactly what we need. In other countries, countries and in Europe, it has been licensed for cats. Here in the United States, we use it off label. But our main dosage that we use it at is 0.625 to 1.25 milligrams per cat, up to 2.5 mg per cat per day. When we start them on therapy, and typically we start a cat, if they're under 200 millimeters of mercury, their blood pressure, we will start them at 0.625 milligrams once a day and see what happens. Usually I'll reach for the higher dose if I have a cat over 200 or who seems to be in a bit of a crisis. But we're going to typically see pretty quickly a drop of about 30 to 50 in the blood pressure reading. So that's a pretty decent shift, which is really great when we have an emergency. But what are the adverse effects? Gingival hyperplasia is a big one. And I don't know if anybody out there has seen this before. It's pretty dramatic. This is a patient of mine who actually had hyperaldosteronism. So he was on other drugs as well. We needed to keep him on his amlodipine to try to get his blood pressure down, but he had pretty significant gingival hyperplasia everywhere in his mouth. I've had other cats that developed this, that it does go away with a gingivectomy. Just remove it and switch them to something else. You can resolve it. So it is reversible. Other signs would be things like GI upset, of course, hypotension if we're overdosing them. We can see weight loss and lethargy and potentially reduce serum potassium levels. So in hyperaldosterone, we may want to do something like spironolactone, which this cat also was on as well. But the big side effect that I want people to watch for is hypotension and gingival hyperplasia. So what are its limitations? And this actually study just came out earlier this month as well. And this has been a theory that's been circulating recently. So I'm glad that we actually have some data now. But what we were seeing is that cats on amlodipine, we're potentially actually having global RAS activation. And this recent study shows that that is probably happening, which is unfortunate, because the last thing we want to do is stimulate the RAS anymore, especially our cats with kidney disease. What do we know about the RAS? This is harmful long-term. It leads to things like cardiac fibrosis. It leads to salt and water retention. It progresses chronic kidney disease. And so what this paper is suggesting and where it kind of leaves us, of course, there's still more research to be done. But if we have medications, if we're using amlodipine therapy in cats with high blood pressure, that potentially putting them on something, another medication like an ACE inhibitor or potentially an aldosterone antagonist like spironolactone might help counteract those effects. So stay tuned with this. It's something to think about, especially if you have a cat on amlodipine with kidney disease and you're worried that things are progressing. It might be something to think about. So what other options do we have? ACE inhibitor, benazepril. This is something that we see, we've probably used before as well. Unfortunately, this isn't a great option. It only reduces blood pressure by about 10 to 15 points. So we're not really getting that big effect like amlodipine drops up to 50. So on its own, it's not very effective, but it can be used in conjunction with things like amlodipine to really help get a little bit of an extra drop if we need it. We have seen some research that it does help prevent progression of CKD. It can help prevent proteinuria or help treat proteinuria in some cases. You do have to be really careful, though. It is not recommended to administer this drug to cats who are hypovolemic or severely dehydrated. And side effects, usually pretty mild, pretty uncommon, but GI signs, hypotension, in rare cases, hyperkalemia. So what about telmisartan? This is one of the newer ones that we now have. This is an angiotensin receptor blocker. So it selectively blocks the AT2 type 1 receptor, which essentially what that means is that the AT1, or what this type of receptor is, it's responsible for all the detrimental renal effects of AT2. So by blocking it, it actually leaves the beneficial effects of T2 type 2 receptors and helps to spare the kidneys and control blood pressure in a little bit of a different way. It is unaffected by the ACE escape mechanism as well, which is something we see with benazepril, which is why benazepril is not quite as effective. This resource came from the company who produced this drug, their website. So there's a reference here if you'd like to see more. But what they found was that by day 28, you can see at least a 20 millimeter of mercury drop in blood pressure by that 20-day mark. So this is really effective. It works really well. It helps really good. In Canada, it's actually licensed, and in some other countries, for the treatment of proteinuria at a lower dose at 1 mg per kg. In the United States, for the treatment of hypertension. We give it about 2 mg per kg daily. And actually, initially there is a loading dose where it's given twice a day, a little bit lower dose twice daily, and then we go up to the 2 mg per kg long term. For when I would reach for something like this, keeping note that it does take about 14 days to really start seeing an effect. It's probably not what I would reach for first line in a case of target organ damage or an emergency situation, because in those cats, I really want to see right away an improvement, but maybe long term, or maybe that cat that comes in annually and now you're detecting high blood pressure, but you're not seeing any detrimental effects to the patient yet. This would be a great, safe option for them. What are the adverse effects of this drug? GI, mostly vomiting, diarrhea. Typically, it's pretty well tolerated, but of course, most medications going orally, we have that risk of GI side effects. And then again, hypotension. I really don't see a ton of hypotension with this one, the way that I do amlodipine in my personal experience. If anybody has comments on that, please feel free to share. But I see pretty good effects, but it definitely takes a little bit longer to get that blood pressure down. I wouldn't want to use this drug in a cat who is clinically dehydrated or hypovolemic, really sick. I would also probably avoid its use in that acute kidney patient until we get them stabilized and they're in a more well-hydrated state. And then there is some suggestion with this one as well. We need to be a little bit careful later on end stage CKD, because RAS is really important in preserving that renal function. But again, there's a lot of research coming out right now looking at which drugs would be best. So unfortunately, I don't have an answer for you, but something to keep an eye on in the literature as things change. So last few slides here, and then we'll open it up for questions because I see a lot of questions coming in. How do we implement blood pressure in your practice? I think the big thing is educating your staff. They need to know why it's important. What is it that we're seeing, right? Blood pressure doesn't have clinical signs until it's too late. So if we can convince our technicians and those that are talking to these owners initially why it's super important we're doing this, then when you come in and talk to them about it too, they're going to feel really confident that they're getting the same story from both of the both staff members who are discussing things with them. Consider cat-friendly training, right? That's going to help everybody feel better. They're going to feel like they're doing it right. They're going to feel like they're doing it correctly and effectively. Create a cat-friendly hospital environment. That's going to help too. You're creating an exam room that's quiet, that's low stress, so you're going to feel much more confident with the results that you're getting. Definitely read the ISFM consensus guidelines on the diagnosis and management of hypertension in cats. That's an open access resource. Everybody can get that one. And then for those of you who are AAFP members, that hypertension educational toolkit is a fabulous resource to have handy in your hospital. Next, create a protocol. Have a protocol and stick to it. Every senior cat or adult cat over the age of 7 should have an annual blood pressure taken. All geriatric cats should really be getting it twice a year, because these are those cats, remember, as they age, they're higher risk for getting a blood pressure disease. All cats who are high risk because they have other concurrent diseases, chronic kidney disease, hyperthyroidism, heart disease, make sure these cats are getting blood pressures twice a year. And then, of course, any sick cat that comes in, regardless of what the problem is, get a blood pressure. And lastly, I have a couple scripts to share with you on how to talk about this, because this is the big question that I usually get is, well, what do you say? Like, how do you talk to your owners? I don't know if you can screenshot this, but this is one of the scripts that we use in my hospital, and I'll just go ahead and read it. So we'll say, this is for reception staff or our CSRs, as we call them, and the nurses. Hey, today Dr. Saffire recommends that Sassy has a blood pressure measurement taken. Cats are notorious for hiding health problems, even from their pet parents, until they become a big problem. Hypertension is common in cats over 7. It doesn't have any obvious clinical signs until it's too late and damage has been done to the eyes, the heart, the kidneys, and the brain. Therefore, it's important we start monitoring Sassy annually. If her results are normal, that's fantastic, and we'll have a great baseline to refer back to next year. It'll allow us also to catch small increases before reaching concerning levels. The cost of the blood pressure is blah, blah, blah. Are you okay if we do that here in the room with you today? And I hardly ever have an owner tell us no, unless they just weren't financially ready for that visit that day, because we do charge an additional fee for our blood pressures. So if that's the response from your client, they say, I can't afford that today, I wasn't prepared for that, the response should be still, this is super important, right? I understand this wasn't something that was expected for today, but because we feel that it's really important to monitor Sassy's blood pressure, let's schedule her as a nurse appointment. We'll get it done at a later date instead. When would work for you? And then get that forward booked. So they realize and recognize that this is super important and we want these cats to come back and get those blood pressures. And then as you start talking about this annually, the owners start to expect it. They start to know what's happening. And they actually really love watching blood pressures on their cats because it's cool. We use these neat little devices that they don't use in people. And they think it's really great. Everybody gets their phones out. They like to take pictures. So they get to be involved, especially if you leave the cat in the exam room. And we get to see, they get to see a neat test being done on their patient. So with that, does anybody first show up this is my main question page. And then I know we have a couple closing slides, some thank you slides and lots of questions. This is my Thanksgiving joke, but Tanya, are you there?
Yes, I am here.
Okay.
Hi there, I'm here too. I'm gonna go ahead and jump into the questions if that's okay.
Yeah,
All
that
right.
would be great.
First question right off. As you know, we have both cat parents and veterinary professionals that attend our webinars. And one of our cat parents wants to know, is there any affordable way or equipment to do blood testing at home?
Yeah, so it's a really great question. So there are actually a couple, I've had a couple patients or caregivers who had cats with blood pressure that were diagnosed and the owner just really wanted to keep a close eye on their cat. And so unfortunately, a lot of the ones that are affordable are not validated, meaning that they haven't gone through the testing to make sure that they're 100% accurate. However, the way that I sort of look at it is if you get a baseline blood pressure at your doctor office and you know that this is an accurate reading and you want to purchase a device at home for yourself, see what they are. Do they match up? Also keep a baseline. The biggest thing that we want to look for is trends. So maybe his number is not the exact same as what we were getting in the veterinary hospital, but if you're measuring it occasionally and it's always about the same, 5 to 10 points, and then all of a sudden it's starting to go up and get really high, that could indicate that there is an issue. And so that might be a time to reach out to your doctor. I still would definitely not diagnose disease on any of the home units, but there are a couple that I have seen that owners will use and they seem to work fine.
Awesome. Are there any oscillometric blood pressure monitors that compare to Doppler?
So the high definition oscillometric is one that seems to be pretty good. They all have their positives and their minuses. Really what it comes down to is what works best for you and your hospital. I have a Cardell ECG monitor that we use that we're using usually during surgery. If we have concerns, we'll get the Doppler out. But typically for my appointments, I like Doppler. That's the one that I reach for. But I mean, any of them, the validated products in cats will do a good job. It really comes down to your experience and what you're comfortable using.
Okay. Here's a great one. I love this one. Is CKD masked by hyperthyroidism?
Yes, that is a talk for that could be a whole talk on its own. So yes, so CKD can definitely be masked. What we see is the hyperthyroid state causes an increased GFR. So we're seeing this overfiltration. We're getting more blood volume to the kidneys. So the kidneys are working harder. They're filtering faster. So it looks like the kidneys are operating fine. And that's what we get, that classic masking of kidney disease when we start to treat the thyroid and then the kidney disease starts to sneak out. One of the things we know, a little clue to a cat that might, if we're not sure we've got both diseases going on at the same time, because maybe we haven't treated hyperthyroidism yet, cats who have very dilute urine, so the loss of urine concentration ability, typically if it's existing at the time of diagnosis of thyroid, usually indicates that there is underlying kidney disease. Typically thyroid doesn't affect the concentration ability. So if I have a cat who's got a really high thyroid and really dilute urine, I'm going to be pretty nervous that cat probably has underlying kidney disease that's being masked. So that's a tip.
Excellent. Can you speak to the possible role of rapamycin as a potential benefit to treat both CKD and systemic hypertension?
So I
Don't you
can
love those questions?
I know. So this is a super exciting new potential therapeutic coming out. The rapamycin CKD study that some of you, maybe what you're referring to, just wrapped up screening and enrollment. So they are now finishing out with the cats in that study. Really hoping to see some results. I have had some owners who have actually done research and been like, can I start my cat on rapamycin? And in the studies we used, not we, but the veterinarians doing the studies used a different type of rapamycin. It was more of like a long release, extended release. It's not what's available that you can get at pharmacies. So I wouldn't recommend prescribing it right now. We just don't know enough information, but it is exciting and it's hopeful that it could help. We just don't know yet. And the data just hasn't been released yet. So I don't unfortunately have any inside scoop yet, but I know it's coming. So stay tuned. I'm sure the abstracts will start coming out soon.
This is kind of a strange question. What's the role of feline distemper vaccines in CKD? I don't know. This is probably from a cat parent that might have heard something.
Maybe someone So there shouldn't be. So vaccines, typically, if you're using an approved vaccine for cats, there shouldn't be a risk of developing distemper virus from that. If a cat has a disease and it causes damage to a kidney, that's a different story. But the vaccine itself shouldn't cause the disease, and it shouldn't, if that's what you're saying. Or did they say the vaccine, or are they saying
it
the
just
actual
said
virus?
the role of feline distemper vaccines?
Okay. Yeah, no, I'm 100% vaccinator. I want my cats all vaccinated. Now I'm a minimalist. I want to do minimum that protects the cat, and especially considering life stages. But for young, healthy cats up to 10 years of age, there's no reason to think twice about every 3 years boostering their distemper vaccine. Once they become a senior and they start having other potential concurrent illnesses or diseases, or if their lifestyle or risks change, then I might reconsider how often I'm vaccinating them. But that's a discussion I have one-on-one with my patients, owner, or the caregivers.
Well, does pre-visit alprazolam affect blood pressure?
Oh, so I actually don't use alprazolam. And off the top of my head, I don't remember if I'd have to look that one up. So that would be something, if you want to maybe email me that question, I can get back to you, because I actually don't know off the top of my head. I'd have to go quickly remind myself. I don't believe so though, because typically there's not any cardiovascular effects with that drug. So I would assume that the blood pressure would be somewhat stable. So I think you'd be fine, but I don't want to 100% say that. But I wouldn't suspect that you'd see too much changes there cardiovascularly.
Okay, I wanted to add that I did add the Dr. Saffire's email address into the chat. And so, yeah, please definitely
please reach
send
out.
that question to her again. Also, for anybody whose questions we don't get to, just remember that you can ask her related to this topic. So somebody says, I'm assuming that GABA could be part of a therapy plan for hypertension then as well.
So I don't know if I would go that far just yet, because we don't fully understand the complete physiology. We know that there is probably some changes happening based on the mechanism of action of gabapentin, but I don't know that I would use it for treatment of blood pressure or hypertension at this time. It's more, I would be aware of the potential change in blood pressure it could give you. So it could drop blood pressures down into a normal range when a cat actually is hypertensive, and we didn't know it, and especially a cat who has CKD. I'd be very careful.
Oh, I didn't think about that. Let's see. What machine do you prefer for blood pressure?
Oh, I prefer Doppler. That's my favorite. I like that one. All my technicians, even my assistants in the practice, are really efficient and proficient at getting blood pressures. So,
well, and as a technician myself, I know blood pressure in cats was kind of a newer thing when I was still in practice. And but one thing that I figured out is practice.
Yeah.
Because the quicker you can get it done, less stress for the cat, but you have to practice. You can't monkey around with it.
Exactly. A great time to practice is when they're under anesthesia, getting a dental. You can sit there and practice and check all the limbs, look for pulses. That's usually how we train people.
And take the cuff and practice. Take the cuff and practice. Just practice being able to get it on quickly, because
Yep. You want to do it fast. Yeah, if you can. And sometimes I'll even like put the cuff on the cat and then like talk about something else for a while. So they forgot I touched them. And then I go ahead and put the Doppler, crystal on. I do have one comment though about the last thing, the gabapentin. I should say too, those studies that we were doing, those were sedatives. So that was the use of gabapentin for sedation for exams. So specifically they were getting like 10 and 20 mg per kg, which is a much higher dose than you probably would give daily, because otherwise you'd have a pretty sedated cat. So I don't know that you would see those significant blood pressure changes in a, if you had a cat on like a 5 mg per kg dose for potentially pain or anxiety at home. So I don't know that that would be high enough to get a blood pressure. We didn't look at lower doses, so we may not see a blood pressure change in those lower doses. So I guess just to circle back to that question, if you were going to use it as a therapeutic for treatment of blood pressure, you'd have to be giving them probably higher doses, which would be, they'd be sedated all day long. You don't want that. So
Yeah, that was somebody had a follow-up question of why was gabapentin chosen. So
yeah.
I hope that answered that for them too.
Yeah.
Okay, let's see. We answered that one. Is Doppler the preferred method of blood pressure measurement? And if so, do you recommend tail or leg?
Okay. So the ISFM blood pressure guidelines are open access. I definitely recommend if you're struggling to decide which blood pressure machine you want to get, they have a really great review of the different blood pressures options or how to take them and their pros and cons. Cost is a big one too. It comes down to the expense. And availability. I use in my practice Doppler. That's just because that was how I was trained in veterinary school. That's what we use for standard of care for most studies involving blood pressure. It's most predictable. So that's the one that I like. Regardless, you always want to make sure that you're making sure that your machines are accurate, that you're calibrating them regularly. But really, I think it just comes down to personal preference at the end of the day. And you get a feel for how your machine operates and when it's going to be more affected by situational hypertension. So there's really not a right or wrong answer. I think sticking to either the Doppler though, or one of the oscillometric is going to be the way to go.
And is there a lot of difference between tail and leg readings?
Oh, yes. And then that part. So this is also where research is always fun. So like at one point, everyone was saying the tail is the best place in a cat because it's less affected by, muscle and they don't care it's there. But actually some cats, the tail might not be as accurate because a heavier or an obese cat, you're going to have a more conical shape of the tail. And so it could actually give you poor results. Also, like some cats just don't like the tail being touched. So I prefer a limb. I think what the studies currently are telling us is it's most accurate to do a limb if you can. Ideally, you want that limb, like if they're laying on their right side, you want it to be the upper limb, so the left limb that's up, and as close to level with the heart as possible so that you're not getting any changes in blood pressure just because you've got different positioning.
Oh, fantastic. Okay. I hope I say this right. When discussing telmisartan,
yes,
you mentioned not recommending it with very dehydrated cats or lethargic. Do you start with amlodipine?
Yeah.
So I would meantime, or wait until they're fully hydrated?
So I think it all depends on the risk, right? So like if they're dehydrated and they have severe hypertension, you gotta be really careful because as you rehydrate them and you increase their blood volume, their blood pressure could go up higher. And telmisartan is probably not going to help for one, because of the fact that it takes 2 weeks to really kick in. You want something like amlodipine. And there's some other pharmacokinetics that can happen with it that when they're hypovolemic or dehydrated, it's just not very safe to use. So ideally you're using like a telmisartan in a patient who is more stable, that comes in, we diagnose them with kidney disease. They might be moderately hypertensive and you want to get them started on something. That would be the case that I would start them on telmisartan. Or proteinuria and kidney disease would be also helpful.
What are the reasons for hypertension after treating for hypothyroidism? Is it because of unmasking?
Yeah, it could be. I actually am not sure the true reason for that. I think I did at one point. I probably did at one point. Now it's just like the fact for me being like a clinician in general practice. I'm like, once I learn a fact, like it's ingrained in my head, versus some of my colleagues who are at like academia and can tell you all the physiology steps for everything. But I I can't remember. And I don't know if it's partly because you're kind of bringing everything back down to normal homeostasis in the body that it unveils underlying like kidney disease, or just things are more normal, that they're not all over the place. And so you're revealing underlying conditions. But it is a phenomenon that happens, and it's important to just make sure that if they're normotensive at diagnosis, that you are you're checking them once they're euthyroid. And the same goes in reverse. I've had cats that have come in severe hypertensive crisis. I've had cats that were in heart failure as their first clinical sign of thyroid disease. They have pleural effusion and they're hypertensive, and then we treat the thyroid disease that we diagnosed at that time, and the heart disease resolves, improves, and the systemic hypertension goes away, and these cats are no longer on any heart meds or hypertensive meds. So it's a weird, I think thyroid disease just messes with everything in the body, and I don't even know if anybody really knows. It's just the fun game that hyperthyroid is.
This is a comment that I want to share. Read the vaccine question. I think the questioner was thinking about studies done by Dr. Lappin. Many feline core vaccines are grown on Crandall-Reese feline kidney cells. There are traces of the vaccine, and Dr. Lappin observed that cats developed antibodies to it. He was concerned that it could be a factor in developing CKD in cats. Last I heard, he was not able to find a direct relationship between the antibodies and kidney disease, but he suggested that it might be a reason to consider that with FBRC or FBRCP. So.
Okay, that might be what the question was from earlier.
Yeah,
okay, yeah, and it is. And I think like right now, like I feel so blessed to be a feline practitioner, because the research and the people who are donating for grants, and I mean, every cat, I mean, you guys, this is awesome. We are getting so much data that we never would have had probably even like maybe 2 decades ago now. But I mean, we're just getting so much information every day. New studies are coming out. So I really hope that, especially chronic kidney disease, it is a hot topic, and there's so much research going on between especially Dr. Lappin and Dr. Jessica Quimby. We are seeing so much information every day coming out. So hopefully we will get more information on that kind of stuff.
Okay, well, I just dropped the link into the chat.
Excellent.
If you want to go ahead and give early for the Giving Tuesday.
Yes.
Yes. Because this is how we pay for
research projects.
all the research that we do, and without this research, I think so. I started in veterinary medicine in the late 90s, and there is so much now that we know that we didn't know back then, that just I mean, it's like medieval back then almost. That's how much, but that's because research and people funding research. So all right, we are a little over. I'm going to turn it over to Tanya. I want to thank Tanya very much, to thank Base Paws for sponsoring and supporting Every Cat and sponsoring this webinar. I thank Dr. Saffire. When do you take over as president of?
I'm president-elect until the fall. So at the AFP conference in the fall, I get to be president next year. I'm super excited.
I think that's exciting. That's exciting. So,
thank you.
Tanya, anything? Jump in there. Tell me.
I thank you, Dr. Saffire, for this excellent information. And if you are interested in learning more about genetic testing for your feline patients or for your own cats, you can visit basepaws.com to learn more.
And it's important to realize that sometimes that genetic testing can actually help you and your veterinarian with some possibilities.
It sure can.
If you know what I mean, your cat may not look like like a particular breed, but there may be that breed in their background. So that is important.
And the Base Paws genetic tests look for a lot of things, and the polycystic kidney disease is one of them. And actually just had a case this week of a domestic short hair with it. So, it's nice to know those things before you're surprised by them. So it's definitely helpful. Yeah.
All right. I'm going to go ahead and let this go. I did put Dr. Saffire's email in the chat if you want to quickly go back and get that off of there if you want to. Also, the link to Every Cat's Giving Tuesday, which is available now if you want to, be an overachiever and give early. So yeah, you can certainly do that. Otherwise, thank you, Dr. Saffire. Thank you,
Yeah,
Tanya.
thanks, guys. This
Thank
has been
you.
great.
Have a
Thank you,
wonderful
Base
day.
Pause.
Happy
Thanks.
holidays to you all.
Thanks, everyone.